Hello, everyone. Thank you for joining us. I'm Sean Lesser with the Real Mental Health Foundation, also the host of the Real Mental Health Break. Thank you so much for joining us today. I'm very excited that we have Sarah Phillips from the Carter Center on with us. She's going to introduce herself in just a moment or so. But for folks that are new to this channel, couple little bit background on me and a little bit of background on our foundation. So it's Sean Lesser from the Real Mental Health Foundation. Just a little bit about me. Born in Brooklyn, grew up in Long Island, went to Syracuse University. And then on my resume, I did 15 years. I did international institutional equity sales. I used to sell stocks to banks overseas. And then in 2007, with a partner of mine, we started the first impact investing investment bank. We'd raise money for companies, for funds, do different investor convenings, online investor portal. And I did that for 16 years, and that's great. Then what are you doing in mental health? So I had my own mental health journey that took me to two treatment centers and some other interesting places. I got out around 6 months ago, and I really wanted to use that experience to help other people because we are in a mental health epidemic. It's been said everywhere. So there's a lot of men, women, and families that are suffering. And I think the Real Mental Health Foundation can help. With that, another group that's helping a lot longer than me, and Sarah and the Carter Center. So, Sarah, can you give a little background on yourself and a little intro to the Carter Center, if you don't mind?
Absolutely. Yeah. Thank you for having me today. I'm excited to be here and chat with you. So, my name is Sarah Phillips. I am the Senior Public Policy Associate with the Carter Center's Mental Health Program. So, I'm still a bit of a newbie with the Carter Center. I've been there going on about 8 months now, but I have a background in health policy. Previously, I worked with organization called Georgia Watch, also based here in Atlanta, where we worked in consumer protection primarily. My scope of work was health access and financial protection, which really allowed me to find my sweet spot with health access and my using my personal passion of mental health is what brought me to the Carter Center after many years of admiring the work of the Carters and the just amazing work that the organization has done since its founding in 1982. So the Carter Center was founded by President and Mrs. Carter back in 1982 after his second run for president. And it was founded to really tackle a lot of issues, both health issues and peace issues. We seek to prevent and resolve conflicts, enhance and promote democracy, and improve health among communities globally. Um, Now, Mrs. Carter has been a champion for mental health since she was back in the governor's mansion. So she's been a big pioneer in destigmatizing these conversations, talking about mental health when it was still a really taboo thing to talk about in the public eye for over 50 years now. And so in 1991, she founded our mental health program. And it's taken a lot of different forms over the years, but right now we have three main pillars or three
Mm-hmm.
main focus areas that we really lean into. Um, One is public policy, which is where I focus. We also have global behavioral health, which focuses on system strengthening and workforce development in West African countries. Primarily, it's been Liberia, but now they're expanding to other regions as well. And we have the Rosalind Carter Journalism Fellowship, which trains and educates journalists on how to report sensitively, accurately, and effectively on mental health topics, which historically have been one of the most underreported topics, but can be an effective mechanism for destigmatization. So that's a little bit about what we do, and that's kind of, I like to say, I'll informally refer to us as sort of the global behavioral health program because
Mm-hmm.
we everything that we do is an avenue towards system strengthening in our behavioral health access.
No, that's super cool. Also, I've been to the Carter Center because I live in Atlanta, so I went there on a school trip with my kids. I loved it there, and it's sort of amazing when you're saying about mental health and starting in 1991. That's when I graduated college, but people weren't really talking about it then. for sure, right? So obviously, the Carter Center has taken a leadership position, and that's awesome. So maybe we talk a little bit about on the public policy side, because me and Sarah had a little chat before. I also had that shout out to Sarah's mom. She's a big fan. She's watching, so I got to say hi to her. But Sarah, you were telling me a little bit about this thing called the parity law, which I really didn't know much about, or would like to discuss it, but like to get a little bit more information. What is it? What does it mean? What's going on? Etc.
Absolutely. Yeah, that's a great question. So, mental health parity or behavioral health parity, you might hear it referred to as, is basically the concept that mental health and addiction care are covered at the same level of care as care for other conditions, physical, so your medical and surgical sorts of care. Now, it, it can be kind of a hairy topic because uh, in the simplest terms, if you have health insurance, you ought to have coverage for your mental health.
Mm-hmm.
But the one stipulation is that that only applies if your health insurance does cover mental health. So if you have that mental health coverage, then it should be equitable to your physical health coverage. Um, One thing that I like to note when talking about parity is practices that deny coverage or treat payment for behavioral health care differently than they do for our other physical health care. Really, it really reinforces that mental health care is out of the norm, and it
Mm-hmm.
can reinforce that stigma that so often surrounds people with mental health disorders or substance use disorders. And in turn, it kind of runs the other way too, where a lot of the reason that we don't have this coverage inherently available to us is because of that sort of pre-existing discrimination towards people who have these conditions. Um, but parity is so important because without parity, people are often required to go out of network from their insurance plan. They're paying out of pocket for their care. They're paying higher copays or larger shares of their treatment cost for their behavioral health services. They might be limited to only a certain number of visits per year. They might be denied coverage because it's deemed not medically
Yeah.
necessary. Um, and I think one thing that is just bigger than anything is you're in a crisis situation and you're being forced to navigate this confusing insurance system when you're in the midst of a crisis. So, not everyone knows how to do that. I mean, I like to say I do this for a living and it's hard for me. So, it's just a really difficult uh, thing to expect families to deal with when they're already dealing with a mental health crisis. So, if we can eliminate those barriers by enforcing parity, we are just making the entire continuum of care so much easier for um, for our communities and our families.
Yeah, so two things on that, because I have firsthand experience of exactly what you're talking about, Sarah. Because I was, I went to two treatment centers, and my my wife handled everything, and I was kind of incapacitated, and that was a full time job trying to figure out where to go, what to do, what insurance, what takes here or there. It's kind of it's really insane.
It's hard.
It's for anybody, right? It's just so I mean that's another thing that we want to do with the real is be a resource for those types of things. But that was for sure a big issue for me personally. So what is the when you say what is the law of the land right now, or is it by state in terms of who follows parity or who doesn't, or what's how does that landscape look right now?
Yeah, so it's a little bit of both, actually. So back in 2008, we had the passage of the Paul Wellstone and Pete Dominici Mental Health Parity and Addiction Equity Act. It's a
Hmm.
mouthful, so you'll hear it
Yeah.
often referred to as simply MAPIA.
Okay.
Um, but that went into law in 2008, and then subsequently the Affordable Care Act's essential health benefits expanded the plans that are required to offer behavioral health coverage, and then therefore they're also required to enforce parity as per the provisions of MAPIA. Um, so that was all great, but part of the issue is that insurance is regulated on a state by state level.
Sure.
So we have this law saying that we have to enforce parity, but it doesn't necessarily assign agencies or assign specific groups to do
Okay.
those enforcement activities, which is why state level policy is necessary. So, last legislative session here in Georgia, the Georgia General Assembly unanimously passed House Bill 1013, which is known as the Georgia Mental Health Parity Act. Um, and this really just kind of makes sure that the federal parity provisions are seen to fruition here in Georgia. This bill was kind of an anomaly because it had the support of the late Speaker of the House, David Ralston, who I believe this was only the second time that a speaker had carried a bill like this.
Hmm.
It had a lot of people telling their personal stories, and one of the lead sponsors of the bill, Todd Jones, talked about how his son had struggled with mental health crises, and they struggled with parity issues in particular. And so there was a lot of personal story sharing, a lot of media attention, and we kind of saw this big wave of
Yeah.
attention on this issue. Actually, 2022 was named the year of mental health here in Georgia, and now we're hearing it referred to as the decade of mental health, which of course we hope to see that continue, not only here in Georgia but throughout the U.S. and worldwide. Um, but one thing that is complicated about that bill is it is a 76-page omnibus bill that tells a lot of different people to do a lot of different things. So, what the Carter Center has really taken a leading role in is making sure that all of our state agencies have the support that they need and the information that they need as they're carrying out these parity implementation activities for the first time. We are very much in the infancy stage of
Hmm.
this process. And as I'm sure a lot of your listeners know, our state agencies are spread very thin. They've got a lot on their plates. So we're trying to be that liaison that supports them throughout this process and really, really focuses in on parity while there are a million different mental health issues to tackle, we're remaining laser focused on the implementation of parity so that families in Georgia can access their behavioral health care as they should any other type of care.
So let's use a real world example. So, and I don't know if it's, and it sounds like it's enacted already. So what does that mean? I'm in Georgia, right? I have
Mhm.
a, mental health situation. And so what does that mean for me and my insurance or my insurers?
Yeah. So let's say you want to go um, to a therapist.
Hmm.
Your copay for that therapy should be equal to what you might pay for a regular office visit.
Okay.
Now, if it's not, then we recommend starting out by appealing with your insurer. So, taking the steps to reach out to them, ask why this coverage was denied, see if you can get it figured out with them. But then, if that is not resolving the situation, if you're still not getting the care or the coverage that you should be entitled to under this law, then we then you should report it to the state agency that oversees or your insurance coverage. So in Georgia, and this looks different state by state, but since we're here in Georgia, I'll use us as an example. We have the Department of Insurance, which
Hmm.
oversees all private insurance. And then we have the Department of Community Health, which
Hmm.
oversees public insurance. So Medicaid, Peach State Health Plan, Peach Care for Kids, all of those sorts of plans. So you'll want to go to the appropriate state agency based on which type of coverage you have and report a complaint through
Hmm.
their consumer complaints portal, which you can find online. And that way, the state agencies know that these parity violations are occurring and can take action.
Oh, that's helpful. It's always the whole thing is, when you get into insurance, it's always a little bit of a pain in the butt, to be honest with you, Sarah.
Oh,
Everybody knows that,
totally.
right? So if it's just integrated into the system, it'll make life a lot easier. So you don't have to think about these things, right? Because
Absolutely.
the back and forth, and it's just it goes around in a circle. But it's great that you're doing that work, and um, yeah, that's an important thing because mental health versus physical health. You think about it. An example is you break your arm, right, and you go to the hospital. You get back, people sign your cast, and they're all they're high fiving you. But in mental health, you kind of break your brain and you're hiding in the corner. So you also have that stigma around mental health. Are there certain things that the Carter Center is working on around? I know you're doing some global work, but around also the stigma around mental health.
Yeah, so something that, well, I mentioned our Rosalind Carter Journalism Fellowship.
Mm-hmm.
That program was originally founded as sort of a tool for destigmatization around these topics. Mrs. Carter was looking for avenues to help in these destigmatization efforts, and journalism is just one of those ways where people are exposed to information so often and so quickly.
Mm-hmm.
So through that program, we have a cohort of journalists every year who come from around the world. I think
Right.
this year was the first year that we had some journalists from Ireland join our cohort. And this fellowship pays journalists a stipend to work with a certain behavioral health topic for the duration of a year. So it funds them to be able to cover
Mm-hmm.
that topic. And throughout the year, they have access to our mental health task force, the Journalism Fellowship Advisory Board. Um, they participate in trainings on various topics. They have access to resources about um, best practices for language, for example, when reporting on mental health.
Mm-hmm.
And this is just all in an effort to uplift these really important topics. Our program actually found that 1 in 7 stories about mental health subsequently resulted in a policy change.
Wow.
So we really see this program as an effective tool to help us in developing our workforce and enforcing parity, in destigmatizing. It really has done some amazing things.
No, that's awesome. And then of course you said task force. That sounded cool. So I'm trying to figure out what that was, the mental health task force. What's a little info on that?
Yeah, that's like it is cool.
I
It's
don't
a
know. It just sounded cool.
yeah, it's a group of experts in behavioral health, some of them with a provider background, some of them with a policy or a legal background, and they all are just really, really esteemed experts in the field. And we don't only pull them in for help with the journalism fellowship. I mean, they collaborate with us on a lot of things in the mental health program. So they're kind of a board of trusted experts
Hmm.
and resources that we tap into, because we certainly don't claim to know everything on our small but mighty team. And we like to use our contacts to get work done effectively. So, yeah, I encourage you to check out our website. If you go
Hmm.
to cartercenter.org and look at the mental health program, you can see a listing of all of our task force members. And there's some impressive folks there.
That's awesome. That's awesome. And then you're also mentioning in the beginning that you're doing stuff not only in the US but globally. Can you talk a little bit about those different initiatives that you have across the globe?
Yeah, so let me preface this by saying that I would defer most of that information to my colleagues who work in global behavioral
I
health.
won't tell them. You can. We'll say it's okay.
They could certainly speak to this better than I could, but they have worked a lot on system strengthening in post conflict Liberia. So,
Hmm.
Liberia has had 2 civil wars, a lot of just unrest over the past several decades. And it came to a point where there was one mental health provider in all of Liberia. And of course, as we know, living sort of at the tail end of a pandemic, that sort
Yes.
of unrest leaves us with an uptick in mental health conditions. And they just had such a lack of resources. So I want to say it was, don't quote me on this, I think it was 2010 that the mental health program embarked on our work in Liberia. And so they started with a curriculum for psychosocial social workers in
Hmm.
Liberia to
Hmm.
just learn more about about the profession, about being a frontline worker in this sort of landscape. But now, what that's turned into is the first of its kind master's level course in mental health with the United Methodist University in Liberia. So, we have a dedicated staff member who is specifically working on this curriculum and really, really broadening our workforce in that part of the region. And then they're also working on a digital dashboard, which, again, I'm certainly not the expert on this,
Okay.
but it's landscape mapping for all of the clinics and providers and resources in the country. So not only can it be used as a directory for folks who are seeking that care, but it's also used for allocation of resources and providers when we're figuring out where the needs are.
That's super helpful. So I have a more difficult question for you. Hope you're ready for this, Sarah. So, no, the obviously the Carter started this in 1991. So, what was the impetus for them to get, if you know, to get started in this space when people weren't really looking at it? Was something in the family? Was what occurred, or what was the reason behind that?
I don't know if there was a certain stimulus in 1991 that really
Yeah.
sparked the creation of the program at that moment in time. But what I will say is Mrs. Carter has just been such a pioneer for these topics for so many decades. And like I said, she's talking about mental health before it was cool to talk about mental
Yes.
health. And her and former First Lady Betty Ford actually had a very cool partnership back when they were both still active and working. Where of course Betty Ford really worked with substance use disorders, and Mrs. Carter focused on the mental health, and she also focuses a lot on caregivers and the rights
Mm-hmm.
and resources for caregiving, which I'm sure you heard about her recent dementia diagnosis, which makes her years and years of advocacy all the more topical. Um, but I think just when I think of Mrs. Carter, I just think pioneer. I
Yeah.
think
Yeah.
that she was really unafraid when talking about these difficult topics. And she's been doing it for a long time. And it's really a very cool opportunity to get to carry out her legacy. A lot of the things that we're doing today are things that she was advocating for decades ago, which may just be a testament to how slow policy can move sometimes. But
Or she was ahead of her time. Again, there's
she
both.
was
Maybe both.
yeah, she was certainly ahead of her time.
So I have to tell you, I met Jimmy Carter.
Did you?
Yes, but it was very brief. So I was on a flight. We're obviously in Atlanta, and we're here at Delta, and I don't even remember where I was going. But Jimmy Carter got on the plane with the Secret Service, and it was interesting. This is just a side note. He went around and shook everyone's hand on the plane as he was getting on. So he's a good guy.
That's
So
awesome.
so on that, just thinking about the legislation and thinking about politics a little bit, and I think this is one area where there is no real debate. I don't think between Republicans and Democrats is in the area of mental health. So when they were talking about it here in Georgia, I'm just curious: did they have a bipartisan support, or how did that look?
Yeah. The Georgia Mental Health Parity Act was a bipartisan bill. We had Democrat and Republican signers on the bill, both on the House and the Senate side. It, like I said, was carried by Speaker Ralston, who unfortunately has since passed, but he's a Republican. It's definitely crossed the aisle, so to speak. I think everyone, especially um, having lived through a pandemic with existing conditions being exacerbated and new ones arising, everyone's seeing just the continued importance and of making sure that we have access to these resources. And it's really nice that it's not such a taboo topic
No,
anymore. And
right.
thanks to organizations like yours, I mean,
Hmm.
it's less and less of a taboo all the time. I mean, we've got everyone from from the Biden administration to Lady Gaga talking about mental health. So it's a really cool moment to be here and witness.
No, no, no doubt. And just a little bit on my journey. So I've had probably 300 phone calls, and then I presented quite a bit. And every call, every time I presented and talking to people, Republican, Democrat, it doesn't really matter. It's just human beings.
Yeah,
This is always either half a degree or 0 degrees away from everybody. So everyone is basically affected. If you go into a room, and I'm going to be in a room in 2 days, and ask people who's been affected, their family, their friends, um, uh, has anyone been affected? I can almost guarantee you everyone's going to raise their hand, because it doesn't discriminate in any way or shape or form at all.
absolutely.
And then I was on another podcast talking, and I'd heard that half the world's population is expected to be diagnosed with a mental disorder by the age of 75, which is kind of insane. So think of almost half the globe here. Um, so on that, I know the Liberia, but are there other things that you're doing? I know you have the Georgia initiative, you got the Liberia. Are there other places around the country, around the world, that you guys are touching on with different
Yeah.
initiatives?
Well, one thing that I'll share with you that is really big for us right now, and this is jumping back to parity a little bit, but I think it pairs nicely with the work that you're doing.
Hmm.
So, thanks to funding from the Blank Foundation, we have embarked on our very first parity awareness campaign.
Cool.
So, I actually I lectured to a class of undergraduate public health students last Friday, and I asked them, "How many people here have heard of parity?" Not a single hand. And the thing is, that's not weird. That's not
No,
unusual.
I didn't know what it was until you told
Yeah,
me.
it's not what we sit around the dinner table and talk
Yeah,
about.
yeah.
So, acknowledging this need to not only work with our state agencies and support the implementation process, but also build capacity among our communities to advocate for themselves in the meantime.
Hmm.
We've, like I said, embarked on this parity awareness campaign. And this is the first time that we've really done something like this, but we identified two target cities. Savannah and Albany are where we
Hmm.
started. One, because they're both geographically very different. Of course, Savannah is more urban, coastal. Albany is landlocked, rural, a little more of a health desert, so to speak. So we conducted a pre-campaign survey measuring attitudes toward obtaining mental health care and then awareness of your rights under the parity law, not necessarily referring to it as the parity law, but saying, I am aware that if I have health insurance, I have mental health coverage, agree or disagree, questions of that nature. And then we partnered with a PR firm to develop messaging around parody. So we've had billboards, we've
Hmm.
had radio spots, social media ads. You're scrolling through Instagram, there's a reel talking about your rights under the
Yeah,
law.
yeah, yeah, yeah,
We kind of we don't use the word parody anywhere, but
yeah.
we what we thought of when we were developing this messaging was the kind of iconic "buckle up, it's the law" that
Okay,
we
okay.
see driving up the interstate.
Yeah.
So just very consumer friendly, accessible messaging, and trying to enable consumers to know what their rights are. And all of our paid media materials lead back to georgiamentalhealth.com, which is where we talk about what a parity violation might look like and what to do if you feel that you've experienced a parity violation. Like I mentioned to you earlier,
Hmm.
appealing with your insurer, reporting it to the appropriate state agency, walking you
Hmm.
through it in a very step by step process. Um, and then our campaign wraps up fairly soon, and we'll be doing a post campaign survey to see if there's been an adjustment in awareness and attitudes following this campaign. So I say that just pairs so nicely with the work that you're doing
Hmm.
because we we can't really rely on parity violations alone or reports of parity violations alone to know that they're happening, because that relies on people knowing what it is, knowing who to report it to, like
Sure, sure.
taking it the convoluted process of
Yes.
reporting. Um, but what we can rely on are personal stories.
Hmm.
And we have journalists reaching out to us all the time about these issues. We're sharing them with our fellow advocates under the Gold Dome. We're sharing it with our lawmakers when we're talking about the continued need for this sort of advocacy and this attention. So, sharing personal stories about parity and about, I mean, anything mental health, but
Sure,
for the
sure.
sake of this conversation about parity is so, so important in making sure that the law is actually fully implemented.
No, it's great to hear about that. I like the idea with the seatbelt. That makes a lot of sense. And I think it's also um, when you get in a certain place, when you're in a bad place or you have some mental illness, it's also important not that you only know about these things, but the kind of the caregivers are realize what's going on because you might be incapacitated, right? So it's the other people to know the law of the land. I did not know that. My wife did not know that, what you're talking about. So it's good to get educated on that subject because we do have some stories about that. so,
Absolutely.
so Sarah, I want to thank you. It was great to talk with you, learn a little bit about the Carter Center, learn a little bit about you, and also the great work that you're doing. And looking forward to meeting you in person in the next couple of weeks. And really appreciate you being on.
Yeah, thank you so much for having me. Always a delight talking to you and grateful for the amazing work that you're doing.
Thank you, Sarah.